Hi, everyone. I'm Julie Gergis. While we're waiting for everyone to join us, why don't we do an icebreaker? You could have one, if you could have more of one thing, what would it be? And would it be money? Would it be fame? Would it be free time? Or would it be something else? And there's going to be a poll that pops up on your screen where you could fill out which one you would select. But let me also ask our panelists, which ones would you all pick? Let me start with Lee or Greg.
I'm going to say free time.
I'll go with all of the above, including something else, and that something else being delicious food at all times whenever I need it.
Great choice.
That's awesome.
I'm going to go for free time at 72, and insurance actuary estimates seem more and more relevant to me. Time is ticking away, and I wish I had more time that I'm sure I would use immediately and fill up with whatever I thought was important, including mental health volunteering.
That's a fantastic answer, Eric. We'll give everyone a few minutes to fill out which one they would select. And we have some results. Okay, so looks like free time is the winner. I guess if we're gonna have a winner in all of this. So it looks like free time, money, and then something else. Okay, I wonder if more of that was food as well. Yeah. Well, great. Well, let's get started. It's about 12:01. Good afternoon. My name is Julie Gergis. I'm a practice administrator for Justice Initiatives at Integral Care. Thank you for joining us for today's community forum, the 88th Legislature, Preparing Mental Health, Substance Use Disorder, and IDD Advocates. This forum is co-presented with Texas Council of Community Centers, which represents the 39 public community centers throughout Texas, providing services and support for people with intellectual and developmental disabilities, serious mental illness, and substance use disorders. Just to let you know, we are recording today's forum and streaming on Facebook. Integral Care is designated local authority for mental health and intellectual and developmental disabilities for the Travis County area. For over 50 years, we have supported adults and children living with mental illness, substance use disorder, and intellectual and developmental disabilities. Over the last decade, the Texas Legislature has made an extraordinary commitment to mental health. Texas 88th legislative session kicks off on January 10th of 2023. This creates more opportunities to further improve the issues affecting the mental health of Texans, the impact of substance use on our state, and the needs of people living with intellectual and developmental disabilities, or IDD. I'm honored to welcome our panelists who will discuss issues to follow related to mental health, substance use, and IDD, how to track the issues most important to you, tips for testifying before a legislative committee, and resources for those looking to connect with their policymakers to share their story. Lee Johnson serves as the CEO of Texas Council of Community Centers, a state association that represents the community centers in Texas. He leads legislative strategy, appropriations issues, strategic communications, public policy development, and implementation. Welcome, Lee. Greg Hanch, LMSW, is the executive director of the NAMI Texas. He is responsible for providing direction and leadership toward the achievement of NAMI Texas's mission. Welcome, Greg. And then Eric Kunish serves as the NAMI Central Texas Advocacy Committee Chair. He has family members with severe mental illness and is a family member speaker for Crisis Information Training, CIT, with law enforcement. Eric is also on the NAMI Texas Public Policy Committee. Welcome to you, Eric. All right. We'll start with a panel discussion and then take audience questions for the last 10 to 15 minutes. Please type any questions into the Q&A box at the bottom of your screen. We'll get to as many as we can. In case we run out of time, please include your email so we could follow up with you afterwards if needed. So let's go ahead and get started with our first question. Our first question is, what are some of the issues coming up in the next legislative session that you're keeping on your radar? And let me start off with you, Lee.
All right. Well, thank you, Julie. First, I'd just like to say thank you to Integral Care for putting together this event. It's a great opportunity to visit with folks, and we're always grateful for that opportunity. And then I want to thank my colleagues, Greg and Eric, for participating as well. The Texas Council's had a long partnership with NAMI Texas, and we've worked together for years and years on a number of collaborative efforts, and just very much look forward to continuing that work as we get into the legislative session. So, just from a high level, Julie, what I would say is, of course, workforce challenges continue to be a very hot topic in the legislature. That's consistent with the legislative priorities that our board recently adopted. And so addressing inflationary cost increase and stabilizing local mental health and IDD authority workforce is going to be a top priority for us in the session. We collected some information from our system, and nearly all of the local mental health and IDD authorities, roughly 87%, report challenges recruiting and retaining staff. A large number of the local mental health and IDD authorities, roughly 72%, report unusually high staff turnover as a significant workforce challenge. And then vacancy rates across our system of care in Texas, that's the position or percentage of open positions, are as high in some areas as 40%. And what this does is it creates substantial challenges. And according to this information, 49% of the local mental health and IDD authorities are indicating that they either have plans to discontinue or have already started to look at discontinuing or will be forced to reduce service capacity due to the significant staffing shortages. So this is a top priority for our association. Of course, it's a big priority for legislative leadership as well, and will continue to be a focus. Then, of course, youth mental health. Of course, I think everyone here is familiar with the tragic circumstances that unfolded in Uvalde. And we will be working very closely on strategies that will not only incentivize specialized interventions like coordinated specialty care, which is a program I hope many people are familiar with, but also multisystemic therapy. But in addition to those specialized interventions, also looking at the core mental health services that are necessary beyond a specialized intervention. We have an access to care issue, particularly for children and youth in our state, and this is going to be a top priority. As well, the criminal justice and mental health interface. So many communities across the state are today having conversations about creating what's called a diversion center. Here in Austin, you, of course, at Integral Care have these programs. There are other parts of the state that are looking to replicate some of the good work that's been done here in Austin and in other areas that have those programs. Also looking at programs like jail-based competency restoration or outpatient competency restoration to begin to address the fact that people are for a very lengthy period of time waiting in jail today to get access to inpatient care in a state hospital system that is challenged with all the workforce issues that we are dealing with in the community. And beyond that, looking at access to locally purchased inpatient beds. This has been a key strategy the legislature has invested in over the last several sessions. And as we look at more limited availability in the state hospital, having those locally purchased beds in private hospitals is critically important to the future. As well, looking at smaller facilities that could be replicated in this conversation about state hospital redesign and investments in other facilities. And then beyond that, I'll wrap this piece of it as well. Intellectual and developmental disability services are a huge priority for our system. They have not fared as well as mental health services have when you look at investments that have been made by past legislatures. And we'll be working very hard to increase capacity for direct care workers in the system. Those are the folks that do really critically important work. And also looking at adjusting provider rates to ensure that the levels of acuity that we're seeing in the community, particularly for people with co-occurring IDD and mental health issues, that is a huge priority in the system. The rates available today fall well short of being able to address those needs. So they will be high priorities for us as we move into the next legislative session.
Thank you. Greg, anything to add to that?
Yes, thank you so much for the opportunity. It's great to be part of this panel, and I want to thank Integral Care for all the work that it does to facilitate access to mental health services for the Austin, Travis County area and surrounding communities. NAMI Texas works on a number of policy issues at the state capitol. We have a policy platform for the upcoming session that addresses early intervention, criminal justice issues, insurance coverage, medication access, and mental health parity, housing and other ancillary supports, the overall mental health system capacity, targeted populations, specific underserved populations, and then finally, crisis services and suicide prevention. These are all areas that NAMI Texas addresses in our policy platform. We have policy recommendations in all of those areas. A couple specific topics within those: crisis services and suicide prevention. Many folks may be aware of the rollout of the 3-digit number for mental health crisis calls, 988. This is a national rollout that began over the summer. It's a big development in the mental health system. It's important to remember that 988 is more than just a 3-digit number. It's also the continuum of services, crisis services that exist around that number. There are several call centers around the state that take 988 calls, including one operated by Integral Care. We don't have enough crisis services in our state. We have an overall shortage. And the calls that are coming into the National Suicide Prevention Lifeline through 988 are often going out of state. Texas has an in-state call answer rate of only 40%. Within the first year of 988 implementation, it's expected that the number of calls coming into the system will double or even triple. We need to prepare for that. We need our legislature to invest in additional call center capacity, as well as crisis services, someone to respond when there is a need in the community for a crisis responder, and a place to take a person to when there is a need for that as well. Services like crisis stabilization and crisis respite. Texas should increase its investment in mental health crisis services and consider all additional funding options to bring more resources into the crisis system. The other priority that I want to address briefly that Lee touched upon is access to services for people experiencing a first episode of psychosis. The gold standard in care for this population is coordinated specialty care. Integral Care has its RAISE program for that population. There are about 3,000 Texas children and young adults each year experiencing a first episode of psychosis. We know what works for that population. It's CSC, coordinated specialty care, providing a team-based, multidisciplinary approach that promotes patient choice and shared decision-making. Texas has 37 CSC teams, largely federally funded, at 23 community centers across the state. That is unfortunately only about 17% of the capacity that we need for coordinated specialty care. We encourage state leadership to invest state resources to improve access to CSC, and also pass legislation requiring commercial insurance companies to cover coordinated specialty care. Senator Zaffarini, whose district includes part of Austin, has filed legislation in the last session to require commercial insurance companies to provide that coverage, and we expect that proposal to come forward again in the upcoming session.
Thank you. Lots of important work to be done. So thank you both. What is advocacy and who can be an advocate? Let me start with you, Eric. If you'll tell us a little bit about that.
Thank you, Julie. And again, thanks Integral Care for putting this on. My first support group in the Austin area 20 some odd years ago was through Integral Care, and I've come a long way since, and you helped me start. Advocacy definition-wise in the dictionary is generally public support for a recommendation of a particular cause or policy, and for us, that is mental health. And who does it? Anybody does it. There are all kinds of people. For me, as said before, I chair the Central Texas Advocacy Committee. I try to advocate to policymakers under the help of NAMI Texas, and including Greg, of course. I learned about NAMI Smarts. It's a training program with several modules on how to address the policymakers. And it goes beyond just the direct advocacy to me. It's like it's sometimes the mental health classes, like I took NAMI's Family to Family class, and I ended up teaching classes. I teach Family Connections, which is for friends and family of people with borderline personality disorder. Last night, my 15th class graduated, yay. And I co-lead support groups for 9 years. I'm not just on one now, I'm co-leading them well. I'm captain of the NAMI's Walks team. I've done that for 8 years. And I do, as Julie mentioned, the crisis intervention training, working with law enforcement. Did one of those yesterday. And I wear several mental health uniforms like this NAMI Walks for this last year. And that's kind of an indirect advocacy, you can say, by wearing it. And I work with other stakeholders, and I'm impressed with the other ones like Greg and Lee, and help others, and a lot of Integral Care. And so, I mean, to me, advocacy can be different things for different people. We all have our particular roles too. Thanks.
Great. Lots of great work being done. Thank you, Eric. Greg, Lee, anything you'd like to add regarding the role of advocacy?
Yeah, go ahead, Greg.
Thank you. Well, I mean, Eric sums up advocacy very well. Advocacy puts a face on the issue. It helps legislators understand what the issues are and how the people that they represent are affected by those issues. Without advocacy, legislators would have a hard time understanding the day-to-day impact of the decisions that they make. They're going to be looking at a lot of numbers. They're going to be looking at a lot of dollar figures and not considering as much the real world human impact of their decisions. So advocacy is essential, it's critical, and it really needs to be centered in all decision making that comes before the Texas Legislature. I'll just conclude by saying I've seen advocacy work. I've seen the impact that it can have. I've been in hearings, and I know Lee has as well, and Eric, where legislators are visibly moved by the advocacy that is being done, by testimony that is being given. And I've heard both on the record and off of legislators saying it was one testimony, it was one story that changed my mind on this issue. I was a neutral before, and now I'm a yes. I was an oppose before, and now I'm on the fence. This is something that I'm considering. And that is resulting not from a lobbyist, a high-paid lobbyist coming into their office. It's resulting not from a campaign contribution. It's resulting from an individual's human story about the impact of the issue and the magnitude of the decision that is about to be made.
Yeah, Greg, I think you said that so well. You and Eric both. I think about this from a standpoint of the reality in our state is that, we have a part-time legislature, right? So the legislature meets for 140 days every 2 years in odd number years. And, it's kind of a wild thing to think about that, right? When we have a state of more than 30 million people, a biennial budget that exceeds $270 billion, that we have a legislature that meets for just 140 days. Every 2 years. It's just wild. And so these legislators are folks that, they have professions that they do in their communities. They're some of them are business owners, they're lawyers, doctors, they're other professionals, accountants. I mean, people that come to this work come with their own story and their own background. And often they're confronted with a myriad of issues, right? So many issues that they're trying to figure out, what do I do with this? Over the time of their service, they become real detailed and expert, right? But it takes time to build that knowledge base. And I've often found in this work that one of the things that just people, citizens, don't realize is how important it is if they take just a few hours of their time out of their day to go down to the Capitol and to meet with a staff person in a legislative office and talk to them, or even meet with the legislator directly. That is such a powerful statement, because it's not, a professional person that goes into those offices and talks to them for a living, like Greg said, a lobbyist or somebody like that. It's a citizen. It's a person from back home that's sharing a personal connection to an issue that helps a legislator understand it way more than just what they read in a report or on a piece of paper and look at, the data. It helps them really make a personal connection to these issues and these conversations. And so I just say to folks, any chance I get, don't underestimate the power of you taking a few hours of your time to go down and be part of this process.
Thank you. Thank you all. It really sounds like that advocacy is that personal touch to the work that's really being done. Thank you. For many people, the legislative process can be confusing and intimidating. Where does advocacy fit into the legislative process, and how do you go about meeting with a policymaker? And Greg, if I could start with you on that.
Hey, sure. Yeah, absolutely. So as I mentioned, advocacy, it needs to be centered in the legislative process. There are a number of opportunities to get involved in the legislative process. It could be going to the Capitol and giving testimony, or quite simply just registering your position on a bill. You don't always have to get up and speak. You can just show you're a constituent and you support a particular bill. You can sit in the gallery and watch the proceedings unfold. You can reach out and send an email to a legislator expressing your position, place a phone call, and or schedule a meeting with them or their staff. I think those are the main touch points that we have as advocates. The legislative process can be very confusing. It's confusing not just for volunteers, but also for the people who work at the Capitol. Texas has a biennial legislature. It meets in regular session on the second Tuesday of January, and then for the next 140 days in odd numbered years. So we're just over a month away from the start of the session. The governor can also call special sessions, each of which can last up to 30 days. In 2021, there were 3 special legislative sessions after the regular one. We have 2 lawmaking entities that in the legislature, the House and the Senate. The House has 150 members who serve 2-year terms. Presiding officer in the House is the Speaker. Our current Speaker is Dave Phelan, and they are elected by a vote of the House members. The Senate has 31 members who normally serve 4-year terms. The Lieutenant Governor, who currently is Dan Patrick, presides over the Senate, and they are elected statewide. I'd like to just touch briefly on how a bill moves through the House and Senate. A bill is introduced or filed. Only a legislator may file a bill. However, the ideas for bills often come from people like us or from state agencies. For the upcoming session, over 1,000 bills have already been filed. In the last regular legislative session, 10,000 bills were filed. Legislators have until March 10th of next year to file bills unless special circumstances come into play. After a bill is filed, the next big step is that a bill is referred to committee by the Speaker or Lieutenant Governor. There are many committees that a mental health bill might find itself referred to. Some common ones for us are Senate Committee on Health and Human Services, House Committee on Public Health, the Criminal Justice Committees, the Insurance Committees, and several others. The chair of the committee then decides if and when a bill will be considered. If a bill is scheduled for a hearing, we as advocates then have the opportunity to go to the hearing, to give testimony on, for, or against the bill. The committee then has the opportunity to take action on the bill. A committee vote to support the bill in the House moves the bill to another committee, either the Calendars Committee or the Local and Consent Calendars Committee. These committees have discretion over the bills that make it to the House floor. In the Senate, a committee vote to support the bill moves the bill to each senator's bill book in the Senate chamber. The lieutenant governor then has broad discretion to determine which bills get called up for consideration on the Senate floor. Once a bill gets called up, it generally takes 18 votes out of 31 senators for the rules to be suspended for a bill to be discussed and voted on. If a bill passes one chamber, it then goes to the other chamber for consideration. If it passes the other chamber, then it goes back to the originating chamber. They look to see if any amendments were made. And if amendments were made, they have the opportunity to concur with said amendments. Or if they disagree with the amendments that the other chamber made, a conference committee can be appointed by the Senate and the House to work out the differences between the two versions of the bill. And if differences get worked out and the same version of the bill passes both chambers, it goes to the governor's desk. The governor has the opportunity to sign the bill or veto the bill are the governor's main options. You may wonder, how do I stay on top of the legislation that is being considered? I encourage you to stay connected to stakeholder organizations. Just speaking for NAMI Texas, we regularly share legislative updates through our newsletter, social media, and our website. Let us do that heavy lifting for you, telling you where things stand and what actions are needed. I also encourage you to create an account on Texas Legislature online. This is a free tool for tracking activity in the Texas Legislature. You can set up all kinds of alerts when it comes to a specific bill that you're tracking, a particular committee that you want to stay connected to, the subject matters that you're interested in. You can set up an alert for all mental health bills, and you'll get an email update every day telling you what the actions are that have been taken on the mental health bills. Meeting with a policymaker is a key opportunity for us. There are some tips for you that just briefly that I'd like to share with you when it comes to meeting with a policymaker. One of these is planning your meeting out ahead of time. Practice, get your team together in a room and make sure you know which role every person's going to play. Know your issue well. This may seem obvious, but the person you're meeting with, the policymaker or staff, is going to expect you to understand the background of the issue and understand what action you're wanting them to take. I also encourage you to know your policymaker. You'll build a stronger connection by knowing and understanding who your elected official is. What is their background? What are the things that they stand for? That'll help you choose what to say and how you say it. Additionally, make sure to nudge them, but don't push them on the issue. We want to gently shift their opinion in a positive direction. For example, you may shift a lawmaker who is adamantly opposed to a neutral position and not strongly negative. Or you may cultivate them as a champion of the issue. This takes some of the pressure off of you. You don't have to convince your policymaker. Just build a connection with them and nudge them in the right direction. Another tip is using person-first language. We want to use language that emphasizes the person rather than the illness to help the listener empathize. So we say things like the person living with mental illness rather than the mentally ill. Also, make sure to focus on positive concepts like recovery rather than language that evokes pity like suffering. Legislators are more likely to fund success stories. Another tip is managing and expecting spin. Policymakers will naturally tend to move the conversation in a direction that is more comfortable or familiar for them. They may ask a personal question. They may put you on the spot and ask you how you would fix all of the problems. You don't have to have all the answers. Stay focused. Don't get trapped on the direction that the legislator or their staff is shifting the conversation and bring the conversation back around to where it belongs. People living with mental health conditions, substance use disorders, or IDD. Expect resistance, but don't argue with them. You don't have to have all the answers. They're going to try to often put you on the defensive. Acknowledge your policymaker's concern and make a positive point about your issue. Shift the issue back to where it belongs. I know that that's a lot of information. It can seem probably a little overwhelming, but remember, as a person who is affected by this issue, as a person who works in this field, you are the expert. You don't have to have all the answers, but you have to have your story, and you have to conclude with an ask and make clear what action it is that you're wanting the legislator to speak. And with those key ingredients, outreach to a legislative office and meeting with a legislative office is more likely to be successful than not. Thank you.
Thank you, Greg. Really good information on how the bill moves through, as well as very helpful tips that could be utilized. Appreciate that. Eric, anything you'd like to add about tips of telling your story?
Well, I have this book, 6 modules on telling your story in different ways. And we have teachers with each. I think Greg has been my teacher a couple of times. Well, I know that. I remember. But I'll be briefer than that. And one thing, I always get nervous. I'm nervous now. Try to remember that they put their pants on the same way as we do. And we are advocating for us, and they're advocating for them. I mean, they are wanting to have a win-win situation where, because they're representing you, they don't want you to go all ticked off or anything. So you want to win, they want to win. So try to look at that positive part. And there's different types of communication. We're fortunate being in Central Texas. We're closest to the flagpole, as they say, and we could have face-to-face. Sometimes it's solo, or as Greg says, sometimes it can be a team. There's ways to do it with emails, letters, elevators, like the quick comment, phone call, and know who they are. Like Greg was saying in more detail, like I know my senator is Sarah Eckert, and my representative is Donna Howard. Know the salutations, the honorable, depending on what form you're communicating. Dear Congresswoman, and then there's different types of stories. You might be telling a story if you're a peer, if you're with lived experience, or if you're like myself, a family member, or sometimes it's a loss. I'm going to just very briefly go through an example of one, very general, kind of 7 steps here. First is the introduction. Hello, I'm Eric Kunish from Austin. I'm a member of the National Alliance on Mental Illness, Central Texas affiliate. I'm also the proud dad of a daughter with mental illness. I would like to briefly share my story and ask your support for strong mental health care. 2, what happened? She was doing wonderfully as a quiet student and athlete when mental illness affected her functioning. At 17, my daughter quit high school the week she was inducted into National Honor Society. Now 41, she has gone through various things: self-harm, suicide attempts, near-death experience due to drug interactions, many hospitalizations, etc. 3, what helped? At 17, a counselor said, you have choices. None of them are good. He was the first to prepare me for a long and worthy challenge. And it took me a lot of denial time before I went, oh yeah, he's got a point there. We continue to have our ups and downs. She still got her GED and graduated from UT, Hook'em Horns. She is on disability, yet through mental health care and her efforts, she is fighting for a life worth living. 4, how am I different today? Through radical acceptance, I realize her path to recovery is a life path different than what I imagined before, and still a most worthy path. I joined NAMI. I teach mental health classes and do support groups for family members of people with mental illness, and I'm happier with a better relationship with my daughter. 5, what is the need or problem? Treatment has helped and keeps up the hope. 6, what will help others? Thanks greatly to strong mental health professionals and mental health care generally. My daughter is still alive and all her family keeps up the hope and doing better. 7, Greg's ask. Thank you for hearing me. Can I count on you to protect mental health services and give other families the hope of recovery? And a very important thing is follow up, whether it's a email, letter, phone call, whatever. And sometimes that helps because if you're like me, I don't always remember what I wanted to say. And it's sometimes going back, thank you, Representative Howard, for your time. And I wanted to add this also. So the follow-up is also important. And those are my highlights. Thanks.
Thank you, Eric. Great tips and definitely powerful life experience that goes along with that. Thank you.
Thank you, Julie.
So after speaking with policymakers, how do you keep the ball rolling? Greg, if I could point that towards you.
Yeah, and I'll be brief on this one. I think we've already touched these points for the most part. The main point I want to make here is that advocacy is a lot about relationship building and making a connection with decision makers. So how do we do that in the long term? We make them feel appreciated. We make sure that it's a two-way street between us and them, that it's not just us asking them to do things for us on our policy agenda. It's them feeling like we are a resource to them and that we can answer their questions. It's cultivating that sort of role of a subject matter expert for a policymaker so that they can call us and say, there's this issue on mental health that someone approached me about. What do you think about that? Where does your organization stand? So we can cultivate that sort of dynamic by following up with them. When we make a promise, we will send you additional information on this issue. I don't know the answer to your question, but I will get that answer to you. Make sure that we do that in a timely fashion. Sending a thank you note, as Eric mentioned, that goes a long way. Giving them a shout out on social media, tagging them in the post, asking for a picture at the end of the meeting that we can include in our newsletter and thank them. Give them an award at our annual luncheon to thank them for their support and recognize them. These are all things that we can do to establish that rapport in the long term, which pays off for us as we are advocating over multiple legislative sessions with a lot of the same folks for an ever-evolving set of priorities and issues.
Thank you. And so definitely keeping it on their radar. Lee?
Yeah, Julie, thank you. And, I think Greg and Eric have done a great job talking about this. I completely agree. I think it really is about relationships and really that's a long game. Because you've got the opportunity. This is obviously the legislative session is a very compressed time frame, right? The 140 days that we've talked about. But there's a lot happening in and around when they're not in legislative session. And so there are opportunities in the community that you can take advantage of to go out and meet. Legislators will hold public town hall forums. They'll do all kinds of different events. And if mental health or intellectual and developmental disability services are important to you, you should take the opportunity to go to one of those events and have your short statement ready to go to express what's important to you and why it's important to you. Have that ready to go at a meeting like that. And you never know. Just even outside of the legislative process, you never know how a relationship can develop. And so I just encourage folks to do that as well. The other thing I'll say, and this is, as you prepare to go into a legislative office, one of the interesting little things, I'm not a huge social media person, but every elected official is, and it's a part of their day to day. And so, before you walk into a meeting, you might just get a Twitter account just to be able to go in and look and see what did they tweet that day. What have they talked about over the last couple of weeks on Twitter? It's just a good way to have some knowledge about what they care about in the back of your mind before you walk into that meeting. And then the other thing, and I want to really emphasize this because I think, Greg and Eric have both done a really nice job of making these points, but getting connected to organizations like NAMI Texas and the ARC of Texas are really important ways for folks to get connected to this process. NAMI and the ARC both do a fabulous job of keeping track of opportunities for citizens to participate in this process. As I said earlier, when you decide to take some hours out of your day to go down and be part of this process, it's a really powerful thing that people take notice of. And so, we're all very busy human beings. We all have a lot going on in our lives. And so staying connected to organizations like NAMI Texas and the ARC of Texas are really good ways for you to help kind of sort through what's important. Where are those opportunities where you could go down and your story could have the greatest impact? Because Greg is absolutely right. Eric is absolutely right. In the years that we've done this, we've seen stories move a room of people. And it's not anything Greg or I could go into an office and talk about as the leaders of our organizations. It's a completely different thing when a constituent from somebody's hometown comes in and shares a story and makes it real for them.
Thank you, Lee. Definitely the case. I know even listening to Eric's, the snippets we got was very moving. Thank you. Many people believe that their opinion doesn't matter or that it won't change a policymaker's mind about an issue. How have you seen advocacy make a difference? Lee?
Yeah, sure. So, I have seen, incredible things unfold in legislative hearings, right? There over the years. So I'm going to date myself a little bit. I've been through many, many legislative sessions. I was involved in two legislative sessions before I came to the council, and I've been involved in about 8 with the council. So I've been through a lot of them. I've seen incredible things happen. I've actually seen legislators so moved by a young man's testimony that at the end of the hearing, this family had been in the hearing room like all day since the early morning hours when the hearing began. They didn't get to testify until like just past dinner time. And I've seen legislators that were so moved by somebody's testimony that a legislator actually got up off the dais in the hearing room, walked over to the mom and handed his business card to her and said, please go somewhere and get dinner and tell them to send me the check. And here's my cell phone number on the back. I've seen things like that happen. And so, it's not like it really is impactful when somebody takes the time to be involved in the process, to share their personal story. So, I've seen it time and time again on a whole host of issues: mental health, intellectual disability services, early childhood intervention services. It runs the gamut. And so really do give consideration to being part of the process. It makes it a better process.
Thank you. Greg, Eric, anything to add to that or any examples?
Sure. Yeah. I'll give a few examples. One of those issues that we've worked on is mental health parity. This relates to when insurance companies unfairly deny coverage or deny payment for services for a person with a mental health condition or substance use disorder. Parity legislation passed in 2017 requires insurance companies to provide coverage that is comparable to and no more stringent than coverage for medical or surgical conditions. So it's an insurance equity initiative, and that passed in large part because of advocates going and sharing their story. When we talk about mental health parity in a room, we see a lot of heads nodding, because a lot of people have been unfairly denied mental health or substance use disorder insurance coverage. So the stories were told, and it had a moving impact on on legislators and their decision making. Another brief example is funding for mental health clubhouses. We started making that push in 2014. And the clubhouses, the ones that were around at the time, came out in full force to support state funding for clubhouses. This is not something that had been done before. And of course, the legislature gets a lot of requests for various pilot projects and initiatives, pet projects to be funded by all kinds of stakeholders. Clubhouses won the day because of members of the clubhouse community coming out and talking about how the clubhouses profoundly improved their quality of life, how going to a clubhouse provided them with a greater sense of independence and a stronger network of relationships among like-minded people. Austin Clubhouse was a big part of that, as were some of the other clubhouses. And as a result, the state has made an investment of millions of dollars in the clubhouse model. And I think the advocacy work by the boots on the ground, people whose lives are directly affected, was a key ingredient to that happening.
Yeah, Greg, I would add to that too, just adding peer support services as a benefit in the Medicaid program. That happened a few sessions ago, and it happened because of people being willing and having the courage to come and talk about their own stories. It moved the room. We saw it happen time and time again as that bill moved through the House and the Senate and then was signed by the governor.
I'd like to add also, in my experience, the Sandra Bland Act was very helpful as far as criminal justice. One of the things that affected me was that they increased the amount of crisis intervention team training for law enforcement. And that's also brought myself and others into speaking to law enforcement, Austin Police Department, Sheriff's Department, et cetera, in trying to create a better, more empathetic relationship with law enforcement. And they had more increased hours of training, which I think from my experience, we've had like 30 some odd visits in residence experience, and most of it's been very good. I think that act helped a whole lot.
Thank you. All great examples of the power of advocacy, definitely. And prior to going to our Q&A portion, one more question is, what would you recommend to someone if they wanted to be an active participant in the next session? Where can they get plugged in to get involved? I throw it out to whoever would like to answer that.
Well, I'll just say, get connected with NAMI Texas and get connected with the ARC of Texas. Those are two great organizations. There are many other organizations as well. In addition, there are local organizations in Austin that you can get plugged into that pay attention to the session. And I'm sure that Greg and Eric have other examples.
Yeah, well, thank you for the plug there, Lee. Appreciate the love for NAMI Texas. We encourage everyone to go to namitexas.org/advocacy and sign up for our advocacy newsletter. I'll also recommend the Hogg Foundation for Mental Health. Follow their social media, sign up for their newsletter where they send out mental health news alerts. Meadows Mental Health Policy Institute has a lot of great information on their website. And then as far as media goes, my two favorites for sort of state government and state politics are the Texas Tribune has a big focus on state government decision making, and the Quorum Report has a great Twitter account and daily news alerts that help me stay up to speed on what's happening at the Capitol.
Great. Thank you all. Well, it looks like we have about maybe 13-ish minutes for any questions. So let's see what questions came in.
We have a couple of questions, Julie. First one says, any of the new mental health hospitals Texas has built and is building open to IDD individuals?
Yeah, so I'll just jump in and talk about this. There's not any any state policy or statute that prevents a person with intellectual disability from being able to get services in say a private hospital locally. But that said, we know that there are, challenges getting access to those services. This has been a bigger focus more recently, particularly as the state agency, the Health and Human Services Commission, and other members of the legislature are starting to really get their heads around the dynamics around this. As a matter of fact, a year or so ago, the Health and Human Services Commission identified that 35%, and it's actually 35 to 40% of individuals with intellectual and developmental disabilities have co-occurring mental health challenges. So this is a huge topic of conversation at the legislature, and one that we anticipate will continue to grow as organizations like the Texas Commission on Jail Standards and others get more involved, like the Judicial Commission on Mental Health, for example, is another organization, great resource for folks that pay attention to the criminal justice and mental health interface. They, of course, have spent a lot of time looking at the circumstances for people with intellectual and developmental disabilities that come into contact with local court systems. And so this will be a continued focus as the legislature unfolds.
Thank you. Second question, what is a landscape like for a possible expansion of Medicaid in Texas? Is this even a viable policy approach or goal in your opinion?
I'll be happy to speak to that one. NAMI Texas has long advocated for what is often referred to as the Medicaid expansion. This is opening up Medicaid eligibility to low-income adults. This has been famously a tough sell in the Texas legislature. The option's been on the table for close to 10 years now. The legislature has considered bills to pass legislation that would allow for the Medicaid expansion, but they haven't made it very far in the process. However, we still support it. We believe that access to insurance increases the likelihood of a person receiving mental health services, and that is backed by research. It continues to have a tough road ahead in the legislative process. However, there is a coalition of organizations that we're a part of, the Cover Texas Now coalition, that is advocating for Medicaid expansion. And there was just a strategy summit a couple weeks ago to put together strategies for pushing for that option for the state. The other thing that I would say on this, even if the full, Medicaid expansion doesn't happen in the upcoming session, I think that there is a great likelihood of an extension of Medicaid, you might call it, or increasing Medicaid benefits. For example, very much on the table is increasing the length of time that people are eligible for Medicaid benefits in the postpartum phase. Texas passed legislation extending that time to 6 months in the last session. And it seems to me like a 12-month extension is very much on the table. A second example that I would give is I think the legislature is very much open to extending Medicaid benefits for school-age children, particularly paying for school-based mental health services. That because of the focus on school mental health and children's mental health in this session, I think the legislature is likely to pass legislation that will allow Medicaid to pay for more school-based health services, and that would be a big win for healthcare advocates.
I kind of wish that we could have a change. We could call it something different than Medicaid expansion that might be more palatable to some lawmakers, because we can get, it just feels like we're leaving a lot of money on the table if we can get more of what other states have gotten. But that's a big work in progress, or maybe as Lee says, that maybe there's the long game to hope for.
Yeah, and I think that discussion will unfold. I would of course point out, as I know others do, in addition to coverage, right, you have to look at the rates that support service delivery in the Medicaid program that today fall well short of actually covering the cost of care. So it's one thing to have a card in your hand, and it's another thing entirely to have rates that support provision of service delivery that can adequately and effectively meet people's needs. So that has to be part of the conversation too.
Certainly.
Thank you. We have we have a few other questions. We'll see how many we could get to. Individuals with IDD have unnecessary and traumatic stays in local jails while they go through the long process of assessing IDD services and appropriate long-term housing. The SSLCs have not been staffed to provide emergency placements while these individuals are assisted through the process required to obtain Medicaid or access SSLC or ICF placements. Will reopening this service to local communities be a funding priority?
Well, I can take a shot at this. I think what this boils down to is the significant workforce challenge that the state facilities face. As I said earlier, the community services in our system and in other systems face the same kind of workforce challenges. I would say that if you address those workforce challenges for state facilities and for community, you will start to see progress on these issues. It is a funding issue, of course, and it is no doubt driven by the lack of a workforce right now. In fact, in the state hospital system, at last check, this was a couple of weeks ago, there were over 700 beds that are offline in the system. It may be even higher than that now. Because of an inability to recruit and retain qualified staff. I know those dynamics are true for the state supported living centers as well, which of course serve people with intellectual and developmental disabilities. And so, I see the real fundamental underlying issue is a workforce challenge. And that workforce challenge is true for state facilities and also for community services.
Thank you. Looks like one question came in as more of a comment of a request for additional training for law enforcement and crisis teams on mental health issues in persons also diagnosed with IDD. The next question, and we probably have just time for one more, is Rep. Howard's office has shown an interest in amending the permitless carry law to allow integral care clinics to restrict firearms. Her chief of staff is a good point of contact. How can we get all of your support and advocacy in getting bipartisan legislation passed this session to that end?
Thank you for the question. NAMI Texas firmly believes that firearms do not belong in the therapeutic treatment setting. We believe it's counterproductive to people's well-being and recovery, and it can re-traumatize them as well. So we would be very interested in learning more about that legislative proposal. We're a member of the Texas Coalition to Reduce Gun Violence, and strongly support, targeted efforts to reduce access to firearms, given the fact that most suicides are completed suicides result from a firearm, and it's something that very much belongs in the conversation around mental health policy in our state. So thank you for that question.
Thank you. It looks like we could probably squeeze one more. There are a lot of questions in the chat. A lot of them are really good questions. So if your question does not get answered, please do drop in your email address for follow-up. I'm going to skip to how can we better support our clients to advocate for themselves in the legislative process? Could I toss that to you, Eric? I see you wanting to take a stab at it.
NAMI Smarts, get with your affiliates as far as the NAMI Smarts training and learn how to talk to your legislature in an effective way. That's one thing.
All right, thank you. Well, as mentioned, there's lots of good questions. We unfortunately can't get to all of them, but please do drop your email address so that way we do have the opportunity to get back with you. I do want to thank all our panelists for their great and thoughtful questions, for your time, for your insights. And I do want to thank everyone that was able to join us today. We do know that change is only possible when we speak up. Many of us have impactful stories to tell, and we hope the insights and the tools shared today help you share yours in the upcoming legislature. When the forum ends, you'll be prompted to take a short survey. We hope you'll take a few minutes to share your opinion. And again, we want to thank all our panelists and thank you all for joining us today. Thank you.
Thank you, guys. Have a great day.
Take care.